What's up everyone? Hope you had a fantastic new year. If you are new to the channel, my name is Chirag Lathia. In today's video, we're going to talk about the future of digital health. This topic is particularly interesting to me because I stumbled upon a video by Professor Scott Galloway, linked in the description below, talking about how digital health may be the next big thing. Coming from a traditional pharma background, I was skeptical about someone deriving clinical benefit from what might be an app on your phone. But upon further research, I am very excited and interested in the space. Let's dive in. First, we're going to talk about a new trend called the Great Dispersion. Then we're going to discuss the dispersion of healthcare specifically and where digital health can fit into this picture. And lastly, we're going to do a quick dive on Livongo, a digital health company focused on chronic disease today. If that sounds interesting to you, please be sure to hit that like button and subscribe for more content. It helps me out a lot. I'll start with a question. What do companies like Amazon, Netflix, Uber, and Airbnb have in common? They are all following this trend called the Great Dispersion. The Great Dispersion is the idea that companies today are reshaping their distribution networks to remove unnecessary friction and cost. They are using the internet and technology to bridge the gap between a service or a product and the consumer. The current pandemic has been an accelerant to this trend, rewarding companies that have better distribution channels. Let's look at Amazon as an example. Before Amazon, if you wanted to buy something, you had to go into a retail store. Amazon made it easy for anyone to purchase items with their computer, their phone, and now with their voice assistants. They removed the friction of going somewhere to make a purchase and connected the consumer to the supplier more directly. Let's also take a look at Netflix. Prior to Netflix, you had to go into a video store like Blockbuster to get physical discs, and maybe you had to pay late fees if you didn't return it on time. Netflix reduced friction by initially letting people rent discs via mail, and now they're one step closer to you by being an internet app on your television screen at home. In short, if you can deliver a service or a product directly to a customer, and moreover, deliver the service or product with a 10x improvement in speed or cost relative to an existing process, you are taking advantage of the trend that is called the Great Dispersion. So now that you have seen how companies have benefited from the Great Dispersion, where does healthcare fit in? In the next two sections, we will be doing a deep dive of some of the problems with the current healthcare industry and where digital health may be poised to step in and solve some of them. Before we talk about how healthcare might be dispersed, let's first start with the problems facing healthcare today. One way we can look at the healthcare industry compared to other industries is by examining the Net Promoter Score, or NPS for short. The Net Promoter Score is the percentage of customers rating their likelihood to recommend a company, a product, or a service to a friend or colleague as 9 or 10, minus the percentage rating this at a 6 or below, from a scale of 0 to 10. It is a management tool used as a measure of customer satisfaction and has been shown to correlate with revenue growth relative to competitors. NPS has been widely adopted by Fortune 500 companies and other organizations. The metric was developed by consultants in Bain & Company and Satmetrics. Unsurprisingly, if we look at the Net Promoter Scores across industries in 2020, we see that healthcare has one of the lowest scores at 27%. Let's discuss some of the reasons behind why that is. The two biggest reasons are cost and time. First, with cost. In a survey, nearly 1/3 answered that they have, in the past 12 months, decided not to seek medical care at least once because of the cost. The second is time. It takes an average of 24 days to schedule a first-time appointment with a physician. These two metrics may explain why the Net Promoter Score for healthcare is so low. If we look at healthcare more closely, we see that the biggest costs lie in chronic conditions. 90% of the nation's $3.5 trillion in annual healthcare expenditures are for people with chronic and mental health conditions. This means that we're spending around $3.2 trillion towards these conditions. That's more than the GDP of the United Kingdom. We know that it is far better to prevent disease than to treat people after they get sick. This is particularly true for chronic diseases. The thing is, clinical preventative strategies are available for many chronic diseases, but people don't seek them out early or often enough, perhaps because of the cost and time associated. In 2015, only 8% of US adults aged 35 or older receive appropriate clinical preventative services, and nearly 5% received none. Clinical preventative strategies include intervening before the disease occurs, detecting and treating the disease at an early stage, and managing the disease to slow or stop its progression. These interventions, combined with lifestyle changes, can substantially reduce the incidence of chronic disease, as well as the disability and death associated with chronic disease. What if we could reduce the cost and time associated with healthcare and attempt to bridge the gap between the hospital and patients through telemedicine, wearable technology, and augmented or virtual reality? This is where digital health comes in. The traditional acute care model may not fit a chronic disease that requires more close tracking and more frequent touch points. But with digital health, we might be able to fill in some of those gaps. Digital health, which includes digital care programs, is a convergence of digital technologies with health, healthcare, living, and society to enhance the efficiency of healthcare delivery and make medicine more personalized and more precise. The discipline involves the use of information and communication technologies to help address the health problems and challenges faced by people under treatment. These technologies include both hardware and software solutions, as well as services including telemedicine, wearable devices, augmented reality, and virtual reality. Digital health is a multidisciplinary domain involving many stakeholders, including clinicians, researchers, and scientists with a wide range of expertise in healthcare, engineering, social sciences, public health, health economics, and data management. So my hypothesis is that healthcare may be able to leverage technology in the form of digital therapeutics to disperse care more efficiently and fill the unmet needs associated with high costs and long wait times. And I am not alone in thinking this. According to Rock Health, in the past 8 years, the total venture funding for digital health has increased from $1.1 billion to $7.4 billion, and the number of deals have increased from 92 to 374 in 2019. So let's do a quick recap and bring all these ideas together. So we talked about the Great Dispersion and how tech companies like Amazon and Netflix have created new distribution channels to eliminate friction and costs. We also talked about healthcare, which currently has the lowest net promoter score among other industries and has high costs, long wait times, and low patient satisfaction. Then we dove into chronic conditions specifically, which are the low-hanging fruit for healthcare and how they represent over a $3.2 trillion cost to the USA and may not be well suited for our current acute care model. And lastly, we introduced digital health as a potential lever to dispense healthcare more efficiently, taking advantage of technology and fixing the high costs and low satisfaction with the current healthcare system. For this next section, let's do a case study on Livongo, a company that was recently acquired by Teladoc that offers digital health solutions for chronic conditions. Livongo seeks to use technology and data science to improve outcomes for those with chronic conditions like diabetes, hypertension, behavioral health, and weight management. Their stock performance in the past year has been exceptional. When compared to the S&P 500, they were up 450% prior to their acquisition. So what is the competitive edge or secret sauce, if you will, of Livongo? They like to call it applied health signals. They state that too often, people living with chronic conditions are presented with too many health data points to take meaningful actions. So they want to make data-driven decisions simpler and easier for patients. So let me explain this chart below from Livongo, starting with the aggregate section. So in terms of data aggregation, they take cellular connected devices, such as real-time blood pressure gauges or real-time blood glucose values, and they combine that with medical claims, pharmacy claims, or API on other health trackers. And they sort of aggregate all of that data together under one data warehouse. In the next arrow, interpret, what they do is they try to find unique signals from this data. They want to understand the what, how, when, and where to influence behavior. This is the intersection of data science, behavior enablement, and clinical impact. In the second to last arrow, apply, they reach out using their channels to providers, to customers, to employers, to insurance companies. and they provide things like value-based incentives. So free medications, copay waivers on certain medications to overcome the cost barriers associated with chronic disease. And in the last arrow, iterate, they close the loop and begin the process once more, taking the knowledge that they gained in the previous processes to get a little bit better. Through this closed loop system, they are able to change patients' behavior and elicit better clinical outcomes for chronic conditions. They do this by, first, understanding the patient through data, second, clustering the patient into cohorts based on their behavior, and third, testing communication methods to see what is the most effective for that patient or cluster. Let's talk about machine learning through behavioral clustering because I actually think it's very interesting. So how does behavioral clustering work? Let's say they wanted to look at the glucose meter usage in the first 30 days. They take the data from their cellular-enabled blood glucose monitors that can see that patients in cluster D are using their blood glucose monitors a lot, but patients in cluster P might not be using their blood glucose monitors that much. Let's say they wanted to change that behavior from cluster P. In order to do that, they must keep the same clusters, A through P, and perform a new analysis or ask a new question on those same clusters. Now we can see that if we ask a new question, like how long ago was your diagnosis, the data shows us that in cluster P, which is the same group of patients in the earlier analysis, that these patients have actually only been diagnosed a few months ago. And if we ask another question, we can see that this same cluster is also a low user of insulin. Now we know deep insights about this group of patients specifically and can coordinate a message to get them to engage more. And we can furthermore track if that message was successful based on these three analyses over real-time data. This is the power of machine learning, and I know people love to throw the machine learning term out there, but when applied correctly, it can be a great way to close the loop on a fully personalized service like Livongo. Using this system, they can determine which message actually drives behavior change, which communication channels work best for patients of different ages. You wouldn't communicate the same way to an elderly patient versus a teenager, and which clinical interventions like medication, exercise, nutrition, and other lifestyle changes are most effective. So after all that, does it actually work? Well, they have included the following results on their website, and it is quite promising. You can see that their net promoter score is much higher than the industry, in the mid-60s, and is actually quite comparable to services like Netflix. You can see that patients have seen a clinical benefit as well as a savings from using this service. Now that we've reviewed the technology as well as some of the benefits, what are the remaining questions and concerns? I could actually make a whole video about the questions and concerns about digital health because there are simply so many. Firstly, for chronic disease specifically, payers often have difficulty determining the value of chronic condition treatments. The thing is, patients usually stay with their health insurer for roughly 10 years, but the most expensive issues are often associated with chronic disease, and these issues often don't play out for 20 plus years after disease onset. Livongo gets around this by partnering with employers or healthcare teams in addition to traditional health plans. Secondly, what is the approval pathway for a digital therapeutic product? It's a bit of a gray area right now that needs further standardization. Further, how do you prove efficacy? Would it be through clinical trials? And if so, what would be the exact endpoints? Would they be similar to or different from therapeutic drugs? Furthermore, there's the issue of getting patients to use digital therapeutic apps consistently. How do you drive patient engagement and adoption? Also, elderly patients or underprivileged folks may actually not have access to this technology. So how do we navigate that digital divide? Lastly, critics of digital health warn against potential privacy violations of using personal health data. So there may need to be more regulation in this space moving forward. With that said, thank you so much for watching. Comment down below if you had any questions or thumbs up if you like the format of this video. I will read all your comments and reply. In the description, I have added links and sources if you want to read further. I've also placed a few links down below with my favorite services that I use on a daily basis. And if you would like to support the channel, you can click through those. I'm looking to grow this channel to 1,000 subscribers within the next year. So if you enjoyed the content, please subscribe if you haven't already. With that said, thank you so much for watching and see you soon.